Agriculture and Texas A&M AgriLife Extension and universities are coming together to destigmatize the conversation surrounding the mental health and provide resources to those there in the industry. KMR Local 4's Maya Clark has the story.
A lot of us that grew up on family operations, it's not just our farm, it's our family's farm.
Tiffany Lashman, Associate Professor and Extension Specialist in Agricultural Law, knows firsthand the pressures of upholding the family legacy in farming and ranching.
You can't be the generation that loses the farm, and you grow up hearing all about what your family has done and the sacrifices that have been made for that operation.
Making a living in the agriculture industry often leaves you at the mercy of uncontrollable factors from Mother Nature and the economy.
The weather, the prices, insects, diseases, things like that we just kind of have no control over. I think that that's stressful enough. I think then you compound on that sort of the way our work is done. A lot of times it's done alone.
Being in rural areas often leaves those in the industry isolated from medical care and experts who know and understand the life of a farmer and rancher.
A lack of access to healthcare services, lower proportion of those with health insurance, lower access to specialty health services. And so living rurally puts you at higher risk for certain health outcomes. And we know that those who work in agriculture, many of them live rurally, of course. And then you compound that with occupational specific stressors that producers experience.
While some mental health professionals may recommend taking time off, that's not always possible for a farmer. But through AgriLife's new mental health program, Smith is hoping to raise awareness about mental health and the resources.
But we also want to raise awareness and reduce stigma so that people who are experiencing a mental health challenge, whether it be in the general community or someone who's an ag producer, they don't feel ashamed or embarrassed if they need to get care.
One way AgriLife is addressing mental health issues in the agriculture industry is partnering with different universities to provide resources to students entering the industry that include mental health, first aid programs, and training.
Our goal through certification is to just try to help educate the future generations of people in agriculture and the generations that come after them to destigmatize what we know is a problem in the ag industry.
Bachman says they want to make people aware of the readily available resources.
The idea that young people can help be listeners and help be facilitators to get people to professionals that can really help ease the struggles that they're facing.
For those in the industry, it's important to know,
you're more than the market, you're more than the operation, you're more important than the farm.
In an effort to close the gap in access, the Department of Agriculture is asking the Texas legislature to sustain the Farmer Mental Health and Suicide Prevention Program for $500,000 per year.
For those in need of help, you can call or text the National Suicide Hotline anytime, day or night, 24/7. 988 is that number. For agriculture-specific help, call or text the AgriStress Helpline at 833-897-2474.
For more information on Texas AgriLife's program and local mental health resources, go to myhighplains.com.